Anatomy of swallowing disorders. The GI or gastrointestinal tract starts at the lips where the food goes in and ends at the rectum. This course will be concerned with the oral, pharyngeal, and laryngeal cavities. We will also lightly touch on the esophagus. Here's a mid-sagittal section of the head and neck displaying the anatomy that will be of interest to us in this course. We have the oral region, the pharyngeal region, and the esophageal region. And the pharynx can be subdivided into the nasopharynx, the oropharynx, and the hypopharynx. In this frontal view, you can see the primary oral structures of interest: the tongue, teeth, lips, hard palate, soft palate down to the velum, and these faucial pillars along the side. The tongue is a muscular hydrostat, which means it has constant volume, so changes in length will affect width. There's three parts of the tongue: the tip, the blade, which is this body here, and the back or the base of tongue, or the root of the tongue. For swallowing, this part of the tongue is more important in the oral phase, and this part is very important in the pharyngeal phase. There are 32 permanent teeth and 20 primary teeth. The mandible is the lower dentition, and the maxilla is the upper dentition. Teeth are identified using a number system. The mouth is divided into 4 quadrants, and there's 8 teeth per quadrant. In the upper right teeth, you have from 1 to 8, where 8 is the central incisor, and then you go from 9 to 16. Then you just drop down to the tooth just under 16, and you start with 17, and you go around to 24, which takes you to the central incisor. 25 starts at the central incisor and goes back to 32. Here's a picture of lips. We have the upper lip, the lower lip, the hard and soft palate. The hard palate is directly behind the teeth, and the soft palate is a little bit further posterior to that. And then you have these faucial pillars. And there's 2 faucial pillars of interest: the anterior faucial pillars, also known as the palatoglossal arch. It goes from the soft palate to the tongue, hence the name palatoglossal. And then the posterior faucial pillars, which are behind these anterior faucial pillars, and they go from the soft palate to the pharynx. Again, the name palatopharyngeal arch, or some people call it the palatopharyngeal fold. These are the spaces in the oral cavity, and in swallowing, the spaces are important because these are places where things can stay. So when you're dealing with disordered patients, you have to be aware of these pockets. We have the anterior sulcus, which is this pocket right here, and the lateral sulcus, which is this pocket right here. And then, of course, there's the floor of the mouth. So if you lifted the tongue, this space under here would be a good little puddle spot. The muscles that make up the floor of the mouth include the geniohyoid, the mylohyoid, the anterior belly of the digastric, and the genioglossus. In this picture here, we see a picture of a person with their chin lifted up. You have these anterior bellies right here of the digastric going into this loop on the hyoid bone. Then here's the posterior belly of the digastric. This muscle here is the mylohyoid, and in this view you can see the jaw, the teeth, and this is geniohyoid going from the genium of the mandible down to the hyoid, and this is the genioglossus, again going from the genium of the mandible into the tongue. As we noted before, the tongue is a muscular hydrostat, a structure that changes in shape but does not change volume. It is composed of intrinsic and extrinsic muscles. The intrinsic muscles of interest are the transverse, the longitudinal, and the vertical. The transverse is fan-like and goes from the center to the lateral tongue. It narrows and elongates the tongue. The longitudinal is a long muscle in the middle portion of the tongue, and it shortens the tongue when contracted. The vertical are these little up and down fibers. Can you see them in this image here? Up and down fibers, and they flatten the tongue when contracted. The extrinsic muscles of the tongue include the genioglossus, the hyoglossus, and the styloglossus. Here's the hyoglossus here, the genioglossus, which we looked at in the previous picture, and the styloglossus goes to the styloid process and comes into the tongue. The lip is a sphincter-like muscle called the orbicularis oris, which is all around here, and it deals with rounding or compression. The lip function is important for closing of the lips to keep food in. The muscles of the soft palate include the levator veli palatini, which elevates the soft palate, the uvular muscle, which shortens and lifts the palate, the tensor palatini, which opens the eustachian tube and tenses the palate, palatal glossus, which pulls the tongue up and pulls the palate down toward the tongue, and the palatopharyngeus, which pulls walls of the pharynx up toward the palate. Jaw muscles can be looked at as those that depress or open the jaw and those that elevate or close the jaw. Jaw depressor muscles include the lateral pterygoid, the geniohyoid, which we've already discussed, and the anterior digastric, which we already discussed. The jaw elevators, or the closing muscles, are the masseter, which is this really big muscle right here, the temporalis, which is this one right here, and the medial pterygoid, which is medial to the lateral pterygoid. In swallowing, we're also concerned with secretions. So we look at oral secretion glands. We have the parotid gland and the submandibular gland, which secrete a serous fluid and help us with building our bolus. And then we have the sublingual gland, which secretes a viscous fluid. And collectively, these salivas help us to aid in digestion and bolus development. Oral taste receptors has been a big topic. Traditionally, we were taught that the tongue was divided up into taste regions, and you've seen this taste map probably in some anatomy textbook, where the palate is primarily bitter, where the base of the tongue is alkaline, the lateral tongue is sour, and the tongue tip is sweet and salty. Well, this isn't completely accurate because these aren't distinct regions. They're interdigitated and overlapped, and there's also other taste receptors that are not addressed in this discussion. When we look at pharyngeal anatomy, we think about the pharynx as the nasopharynx, or that part behind the nose, the oropharynx, or that part behind the tongue, and the hypopharynx, or that part kind of near the airway opening. Also in pharyngeal anatomy, we concern ourselves with spaces. As you come over the base of the tongue, here's the base of the tongue, and here you have a little pocket behind this epiglottis, and that pocket is called the vallecular. And alongside the larynx here, you also have two pockets called the piriform sinus, one on each side. The pharynx is comprised of three constrictor muscles. The most superior one is called the superior constrictor, or superior pharyngeal constrictor. Then there's the middle pharyngeal constrictor and the inferior pharyngeal constrictor. Now, the interesting thing is that in most anatomy texts, the inferior pharyngeal constrictor comprises the cricopharyngeus muscle. But for the purposes of this class, we will consider the cricopharyngeus as a separate muscle because even though anatomical texts rate them as the same muscle, they have very different functions. The inferior pharyngeal constrictor helps with constriction of the bolus, moving it down in a sphincter-like way, whereas the cricopharyngeus muscle has a very different behavior. So the cricopharyngeus muscle, or the lower bands of the inferior pharyngeal constrictor, is part of the UES region, or the upper esophageal sphincter region, or part of the PE segment. It's a 2 to 4 centimeter zone depending on the height and size of the person. And the interesting thing about the CP muscle is it is tonically contracted. So it's always closed unless the person is swallowing or there's some other effect that has altered the function of that tonic contraction. So for example, sleeping, it reduces tone. Cigarette smoking reduces tone. Certain foods, greasy foods, chocolate, coffee,